Thank you so much for joining us. We're so pleased to have you here to talk a little bit about supporting a loved one with cancer. I'm Rebecca Bowlin. I am a licensed clinical social worker. I'm currently working in outpatient infusion, which is part of the Valley Mount Sinai Comprehensive Cancer Care Center. But prior to this position, where I've been for about 3 years, I was in the main hospital as a social worker for about 12 years. And I'm so pleased to have Yael here this evening. I'm going to let her introduce herself.
Hi, everybody. Good evening. Again, thank you for joining us. My name is Yael Davidovics. I am in my first year at Valley Hospital in the Radiation Oncology Department in the Valley Mount Sinai Cancer Care Center. And I'm very excited to be presenting to you tonight. We're going to start off just to get a feel of who our audience is and who's participating with you with a little questionnaire. So take a look at your screen, and if you could just pick one of those answers. And okay, so we see that some people do have some experience being caregivers. Nobody's currently acting as a caregiver, and we have some people who are new to this role. And I hope that we'll be able to give you the information you're looking for tonight. I'm going to start by sharing my screen with you. We're going to go right to the PowerPoint. Sorry, 1 second. We have to start that from the beginning. Give me 1 second, please. There we go. And we're going to start from here. I hope everyone can hear me. Again, welcome to this webinar on supporting a loved one with cancer. What happens when a loved one is diagnosed with cancer? So, as you can see in this diagram, when a loved one is diagnosed with cancer, yes.
Yeah. We can't see your screen.
Oop. So sorry about that. Here we go.
There we
Perfect.
go.
Excellent. Thank you. Okay, so we're going to start over. When a loved one is diagnosed with cancer, as you can see on the on this diagram, there are a lot of people who kind of step up and want to be supportive and do their part in assisting this person. So it could be anyone from the immediate family, a spouse, a partner, children, parents, your friends, your neighbors. If people belong to a religious community, the people from that community will want to help, acquaintances, work colleagues, relatives who don't live nearby, and hear of the news are going to want to be helpful in some way. And then you also have, just people like past teachers, golf buddies, your knitting group, different people that your loved one may know or may somehow be connected to who are going to want to be of assistance. So we're going to go through how best to navigate all these people and the help that they want to provide. So this is more regarding the general group of support people, because generally the person, your loved one who's been diagnosed, will often pick a primary caregiver that they want, but they likely have a larger group of supportive friends, family, neighbors, and other people that we saw in that diagram who are also eager to provide assistance. So these are some tips for like that wider group of supporters. The first one is to stay positive. It's always helpful, especially nowadays, people communicate a lot by text or WhatsApp, to send a joke, to send a positive meme, to send a beautiful picture you took. Those things are making that person happy. They bring them a moment of joy, and it's better than just texting that person every day. How are you? What's new? What's going on? Is there anything new, any new developments or anything like that? this kind of positive message that you send can show that person that you're there without them having to necessarily respond or give you an update. It's just, the goal of that is just to indicate that you're there for them and you're thinking of them. Another thing is to volunteer to coordinate the support efforts to minimize the burden on that loved one. So, you know, if we think back to that diagram again, let's say I work with someone who I've just heard has been diagnosed with cancer, and everybody at work wants to support them somehow. I can volunteer to be the person to coordinate those efforts, and then I will be the only one to be in touch with that person. And it's better than 15 people emailing or texting and asking what they can do. That, you know, the person who's been diagnosed only has to communicate with that one person, and it's much easier. The next thing is to remember that no two cancer experiences are the same. Sometimes when we hear about someone that's been diagnosed with cancer, we are eager to share that our aunt had something similar, or I have a neighbor who went through something similar, or a friend of mine. And although this may seem like it's supportive and helps you relate to that person, it's not always helpful because everybody's cancer journey is really unique. And it's important to remember that the person you've just heard about is going through their own journey, and it may or may not be helpful to share someone else's. And the last thing is to offer advice when asked. So a lot of times when we can't do something and we feel helpless, we think that offering advice is a good way to be there and be helpful. I heard about some nutrition tip for cancer patients, or something that someone else did, or something, some exercise that they did, or something like that. It's, again, not always helpful to hear advice. Oftentimes patients just need to know that you're there for them, even if you're not doing anything. And, all the things we discussed before are the ways to do that. Okay, so what is a primary caregiver? As we were saying in that diagram, among that larger group of supporters, usually the person who's been diagnosed will choose a primary caregiver. It happens obviously after a discussion, they agree to that person being their caregiver. The caregiver obviously wants to be their caregiver. A primary caregiver is usually a spouse or a significant other, family member or friend who is untrained and does not receive compensation for caring for that person. The role of a primary caregiver. So the role of the primary caregiver is really comprised of a lot of different things. Some of examples are they provide emotional support. When someone gets a diagnosis of cancer, there's a lot of adjustments, there's a lot of things to process. And that primary caregiver can help them go through that emotional work and process what's happening, reprioritize things, and sort of start thinking about their lives in a different way, now that they've done that diagnosis. Another role of the primary caregiver is to assist with activities of daily living on basic care. So that can be anything from cooking, cleaning, shopping, to, depending on the ability of the person you're caring for, it can sometimes require to help them up the stairs, or help them around if they're in a wheelchair, things like that. Another role of the primary caregiver is to help with decision making and advanced care planning. So obviously, getting a diagnosis like this changes certain things in the way people think about their future. And they have to start considering certain decisions and advanced care planning, and how they want to be cared for, and what they want their life to look like. So that's something that they can discuss with their primary caregiver, especially given the fact that they will be with them most of the time and be taking care of those things. And that's an important discussion to have, and the primary caregiver can help them. The primary caregiver also provides transportation. The person who's your loved one who's just received this diagnosis will likely need to go to many medical appointments, to different doctors, different treatment centers possibly, and the primary caregiver is really the person who is going to be taking them there and making sure they're there on time. An additional role of the primary caregiver is to manage the finances, in terms of, again, the capacity of your loved one. It can be anything from paying the bills, the house bills, simple monthly bills, to managing the expenses of the actual illness and treatment. And those are things that the primary caregiver can keep track of and provide assistance with. Another role of the primary caregiver is to coordinate medical care. As I was saying before, once your loved one receives this diagnosis, they will likely need to see different doctors and go to different treatment centers and things like that. It is helpful to have a notebook or a binder where you can write everything down, with a calendar, so you can make sure that everything is written and you can look forward to it and plan for it, that nothing conflicts, and it's a good place to organize all the information. Okay, caregivers and medical care. So caregivers will be a large part of the medical care for their loved ones. So this is also comprised of a few different things. Caregivers are advocates. The first thing that's really helpful is to have a meeting of the family and the closest people to your loved one and decide who plays what role. For example, somebody can be the driver, somebody can be the shopper, somebody else can take care of their personal care, someone can, do prescription pickups. It's helpful to have a conversation to determine who's going to take care of what, so there's no, two people doing the same thing and everyone has their jobs delineated. It's also helpful to assign a point person to communicate with doctors and medical staff. Again, it probably should be the person who's going to be with the patient at the medical appointments. And it's also helpful to have someone who communicates with that larger group of support, because again, the person who's going through the illness does not necessarily want to keep everyone posted every day or every week about what's happening. So it's much easier to appoint someone to keep everyone updated. And nowadays, you can do that with a WhatsApp group, or you can do that through websites like Caring Bridge and things like that, so that everybody's updated without being a burden on the patient. The other thing is to ask a lot of questions. Again, one of the major roles of the primary caregiver is to go to the medical appointments with the patient. It's really important, since you're going to be the one that's going to be with the patient most of the time and taking care of them, to ask a lot of questions. Ask questions about the treatment, ask questions about the side effects, medications, dosages. This way it's much easier to look at things and see what's happening, and if you have any questions, you can then go back to the doctor, have that information, and you know what to expect. Caregivers are also secretaries. They again have to keep track of all the appointments that are coming up. There are different doctors, there are different people that will meet with the patient, there are different medications they will have to take, and medical contacts, nurses or therapists and things like that. As I was mentioning before, it's helpful to have sort of a notebook or a binder to keep all these things in, where you have a calendar, where you have a folder with all the contact information and addresses for these people. And you can also collect any agency resources and information that you've received from someone like your social worker at the cancer center. And this way everything is in one place, and that includes insurance information. So you can have it with you when you go from doctor to doctor, or when you go to new providers. Okay, caregivers and emotional support. So obviously a large part of being a primary caregiver is providing emotional support for the patient. And as you can see, the little picture on the side said being a caregiver is a work of heart. It takes a lot of heart and a lot of emotion. So here are some tips for that aspect of the caregiving. Important things to remember, that your loved one is in charge. It's important to allow your loved one to do the things that they like and to do them by themselves. Sometimes we get into our roles of caregiver and patient, but it's important to recognize that they are still the ones in charge of what they're doing while they can do it, and we should allow that. Another thing is to help your loved one live their everyday life and do the things that matter the most. So again, as long as they can and as long as they would like to choose things, it's important to let them choose what they want to do. So for example, if they really want to prepare dinner for the upcoming holiday, because that matters to them and it's meaningful and it's something that they're used to doing, it's important to let them try to do that. Even if you think that they shouldn't be, or even if you think it's too difficult, let them do it and let them know that you're there. In case they do struggle or in case they do find it hard, you'll be there for them, but they can do something that brings them joy and that really matters to them. If needed, develop a new routine. So again, because an illness changes things in your life and how what you can do, it's important to develop a new routine, but to honor your loved one's wishes to complete pre-cancer chores and tasks and to work independently. So although our instinct is to take away anything from them and to take any burden away, sometimes it's really important to still let them do the things they want and that they can. The next thing is to listen. Pretty simple, but important. It's really important to listen to your loved one when they're speaking about what they're going through, even if it's hard for you to listen to. They sometimes, oftentimes will want to express themselves, and you're the one that's there most often, and you can be there to listen and provide support. On the other hand, you can be understanding if they're not ready to share, because they may not be ready to share at the same pace as you. So it is important to be patient with them and just be there for when when they're ready to share about what they're going through. Be there. Another pretty simple one. Again, it's with listening and being patient. And there are also nonverbal ways that you can be there for your loved one. It doesn't always involve talking. You can write them a beautiful card. You can hug them or hold their hands. There are different ways of showing love and support that don't involve speaking necessarily. Another thing to remember is that it's important to differentiate your feelings from those of your loved one. So you and your loved one are obviously going through this transition because of the diagnosis, and it's really a process that you're both going through, but it's actually different. They're going through their own process, and you are there as their caregiver and going through your own process. And although both ways are important and both all the feelings involved are important, it is really important to remember that they're different and to respect their feelings and of course yours. Both are valid. Again, communicate respectfully. So we all know that when we spend a lot of time with a loved one, regardless of the situation, there can be some negative things that come up, some unpleasant things. Sometimes it's resentment, sometimes it's frustration. Different things can come up when you're spending a lot of time together. The key there is to communicate and talk about it, to communicate respectfully and express your feelings, and hopefully to come out better at the end of it. Talk about things other than cancer. So you have to remember that the person who's just been diagnosed still has a full life other than their illness, and they still have other things happening. So for example, if you have a friend who's been diagnosed with cancer and is going through treatments, but her son just started dating someone and she's very excited about it and wants to talk about it. So talk about it. It brings her joy, and it takes your mind and her mind off of what's going on. If you've seen a great movie or heard a great song that you want to share with that person, definitely, talk about other things other than the illness, other things that bring joy and connection, that are related to the rest of this person's life. And again, because it's important to remember, give advice only when asked. Like I said before, we as caregivers can sometimes feel very helpless, because we don't know what to do. And we feel that giving advice is the way to help. But sometimes it's not what's necessary. The person really, really just needs to know that you're there for them. I'm going to turn it over to Rebecca now for the second part of our presentation.
Thanks so much, Yael. So one of the other ways that you can support your loved one is to consider and be aware of some of the financial assistance that's out there. Cancer is expensive, even with insurance, copays, and the portion of the cancer treatment that's not covered can be expensive. So it's important to be aware that there are resources for assistance. It definitely depends on your loved one's diagnosis, on their needs, and on personal finances, but there are a lot of programs out there. There are financial grants, which hopefully your social worker can help you access. There are often medication copay cards that help offset the cost of medications, whether those are infusion or injectable medications, or whether those are prescription, by mouth. And there are other types of patient assistance programs. At Valley, we're so pleased that we have an amazing patient financial advocate team. They are always available to provide support both to the patient and to you, or the caregiver, the loved one, to address any questions or concerns about billing, and to be a resource for support. And they are also very familiar with the criteria, again, based on need, diagnosis, particular diagnosis type, the need for the assistance and the personal finances, and they can assess patients for their eligibility for copay cards or for other patient assistance programs. So we encourage you, if you are the caregiver of a patient coming to Valley, ask to speak with that team. Mary, Gail, and Christy, they're all phenomenal. And if you are, your loved one is receiving treatment at another hospital or treatment center, certainly, ask to see if they have a financial assistance team that can help you. Another way to support your loved one is often, as Yael has talked about, providing some of that hands-on care and that assistance with activities of daily living. And that's where the Family and Medical Leave Act can come in. That FMLA is a program that, if eligible, entitles you to up to 12 weeks of job protected leave to take care of your loved one. Although it is not paid, which is unfortunate, at least you have that security and know that you will have that job to return to. So we certainly encourage you to ask your Human Resources Department about that program and whether or not you are eligible for it, because being home and being present certainly is a way to support your loved one. In the event too that your Human Resources Department does offer this program, we would suggest,
I'm sorry.
Seems to be having a little bit of trouble there with the slides, but we suggest asking your HR department if they have an intermittent leave option. That 12 weeks when taken all together is about, 3 months or so, but some employers can offer it as intermittent, meaning that you can take, let's say your loved one is getting chemotherapy on a Monday, feels a bit lousy on a Tuesday, then they can you can stay home Monday and Tuesday with them and return to work for Wednesday, so that in the course of a month, instead of taking 20 days, you've taken 8. And that's one way to extend that leave, and one way to be home a little bit longer with your loved one. Before I move on to the next slide, forgive me, I'm going to, I think we're back. Okay. Thanks, Yael. So I'm going to give you a second there before I continue.
I'm sorry.
That's okay. These things happen.
I'm trying to
We're
get
just a
back
couple.
to the slides we were in before. That's there we go. That's
There we
the
go.
next one.
There we go. Perfect. These things happen, no matter how many times you practice. So, so that's a little bit of the financial piece and the way that you can, help with the financial and help with the actual physical being there and caregiving. Another aspect of caregiving can be, a long distance caregiver. And by definition, that is somebody that provides, and you can see it on your screen there, any type of physical, emotional, spiritual, financial, or logistic support from a distance. And that can be really challenging, both for you as the caregiver, as well as for your loved one. So we wanted to go over a few ways to really make that relationship and that caregiving role as easy and as helpful as possible. The first suggestion is really to have an honest conversation with your loved one. What are their needs, and how would they like to be supported? Do they want somebody to come with them to every medical appointment? And is that realistic? Do they want somebody to join appointments virtually? And really to also set kind of your limits on what you can and cannot do. So for example, if let's say you live in New Jersey, but your loved one's in Florida, and the conversation looks like, I can't come to Florida every Monday for your infusion treatment, but I can come once a month, or, every 2 months when you meet with the doctor, so that you have someone there sitting next to you and providing support and a second set of ears. Or if that means your loved one is an hour away and you could go every weekend and help pour medications and do some grocery shopping for them, but you can't be there to cook a meal every night, and so it's really just about having an open dialogue and having those honest conversations about how you can and can't help, realistically, and then working together to develop a routine along and around those needs. So when you might call for support, when you would call to join a doctor's appointment, what virtual appointments you might be able to attend, and in what ways you can help meet the routine needs, filling medications on a monthly basis, things like that. And then maybe creating a list of friends or neighbors, so that who your loved one would like you to call should a need arise. If you're far away and they have, an urgent medical appointment, who could give them a ride, or they ran out of a medication a bit early, who could go to the pharmacy. And then that way, in your role, you would know the neighbor or the friend to call if your loved one needed some assistance. Technology, as we've learned through COVID, really does have its perks. And in this case, there are a lot of features and programs that are out there that can be really helpful for caregiving from a distance. Examples include like a Nest camera. Obviously, with your loved one's permission, you could install a camera in the common area of their home to make sure that they're safe, to make sure they're mobile. And God forbid, if you were worried about a fall or some weakness, you'd be able to kind of watch from the computer to make sure that your loved one is getting around safely. If you were concerned about falls, there's the life alert monitors. You've probably seen commercials and heard of those that you wear around your neck. Even the option of FaceTime, is a beautiful way to be able to join and connect long distance. There are even, as I mentioned earlier, if your role was to go once a week to fill, pill boxes, there are now kind of electronic pill boxes with reminders so that you might go fill on a once a week basis, but your loved one's medications would be ready for the whole week. And they would get a reminder. And so you would feel comfortable and confident that they were taking their medications as prescribed. General logistics can be a really big place where you can offer assistance and support. Sometimes that's paying the bills with some pre-signed checks. Sometimes that's helping your loved one put things on auto pay so that their PSE&G bill comes out once a month, and it's something that to take off their plate that they need to be thinking about on a regular basis. General finance questions, or even reviewing insurance EOBs or explanations of benefits to make sure that your loved one understands, what is being billed through the insurance, what's being covered. And then again, that kind of ties back to those financial considerations. Do you need to reach out to see if there is some assistance as it would be needed? So things like that in terms of logistics. And finally, self-care. And this is going to lead us into a larger conversation, but just because you're not physically present with your loved one every single day, all day long, doesn't mean that you don't need to take care of yourself as well. And at the same time, you're taking care of them. Next slide, if you would, Yael. Okay, so some of you may be wondering why there's a picture of an airplane in the middle of your screen during a conversation about supporting your loved ones. I would imagine that many or most of you have flown on an airplane, and during the safety demonstration at the beginning, the pilot or the flight attendant says, in the event of a loss of cabin pressure or an emergency, an oxygen mask will drop. Please put yours on before you help the person sitting next to you. And that is kind of the way that we approach self-care. And it's so important for you to take care of yourself and to think of yourself. Caregiving is a hard job, and it's so important that you take care of yourself in order to be able to, feel good about and feel well yourself. Yeah, next slide. Thank you. So we really wanted to review some ways that you can practice self-care. The first one is so important, and it is to keep up with your own medical care and your own medical needs. So don't put off your own medical checkups, procedures. Certainly make sure you're taking your medications and refilling them as needed. Overall, generally, just don't sideline yourself and your health to take care of somebody else, because ultimately, if you're not well, they won't be well, and you can't take care of somebody else. So to focus on your health and remember that that's also a priority. Saying yes to you. Sometimes caregiving, is time consuming, and we want to make sure that you are making and taking the time to schedule something for yourself that you would enjoy. In perhaps even a good idea to make a list of those things, so that if you're having a rough day or a tough time thinking of something you can do, you can look back at that list, whether that's a cup of coffee with a friend, whether that's a walk around the block, whether that's, a round of golf or a manicure, or whatever it is that feels good, that gives you a little time for yourself. That's so important. So we definitely suggest that you make time for that and include that. Eating nourishing meals. You need to keep your strength up. You need to keep your energy up, particularly if you have a medical need such as diabetes, where it is so important that you're taking meds, but you also need to be eating properly. Again, it goes back to that. If you're not caring for yourself, it's hard to care for somebody else. So eat healthy, nourishing meals. Getting exercise. A brisk walk around the block can actually make you feel so much better. It releases endorphins. Endorphins make us feel good. So they also, not only did the walk give you something to do, you got out, you had a little break, but you also are hopefully feeling better. Your mood is better. Your spirits are lifted. Getting a good night's sleep. We can't highlight this one enough. Everything is easier. Everything is better with the proper amount of sleep. And sometimes it's hard. I'm going to skip down, but learning to say no. So sometimes you do have to say no to things, and that is okay. Prioritizing the things that can wait, putting them off till the end of the week, putting them on your calendar for next week, learning to say no, then gives you that time to hopefully get a good night's sleep, get an hour back of your day that you can give to yourself to get a good night's sleep. As Yael mentioned earlier, there are tough days as a caregiver, and there can certainly be negative feelings. Caregiving can be a beautiful opportunity to spend time with a loved one. But it can be tough, and it can be frustrating. There can sometimes be feelings of resentment, and that is all common. But the idea would be to acknowledge those feelings so that you can move forward and continue in your role of caregiving. So there are a few ways that we would suggest to help you kind of work through any of those feelings. One of those might be a support group. To join a support group, which is comprised of other cancer caregivers, would be ideal, although any support group is lovely. But meeting or talking with people that are a little bit more familiar with the things that you're experiencing, and who understand those, gives you the opportunity to share and to work through those feelings. If a support group's not quite your thing, an individual counselor, therapist, psychologist, psychiatrist, social worker, any of the mental health professionals can also meet with you one-on-one and help you both discuss feelings and work on ways to work through them and to keep moving forward. One of those ways we've included here is to practice mindfulness, which is really just the idea that you're present with your emotions and that you're allowing yourself to feel what you feel, but without judging yourself. Basically, to give yourself a little grace and to go easy on yourself, knowing that you are fulfilling a role that is not always easy, but just to let yourself sit with some of those feelings. Those are some ways to work through them, to work forward. I had mentioned learning to say no. The last one is to, express emotions. There's a breadth of emotion that you can feel as a caregiver, from those moments of joy to some of the more negative feelings we just covered, but learning to express them, and especially the positive ones, the laughter, making jokes, knowing that it's okay to share all of the feelings that you're having appropriately. As an example, I have a patient, and he always tells me how whenever he and his family do anything or go anywhere together, whether it's out for dinner and the waiter or waitress is taking their order, or they're out at an ice cream store, let's say, ordering, his kind of joke, that has been adopted by his family and his caregivers, is that he has cancer, so he gets to order first. And it's a kind of a big family joke, but it's his spouse thinks it's pretty funny to go in somewhere and say he gets to go first because he's got cancer. And again, the jokes, the laughing, the expression of emotion. Next slide, Yael. And to kind of just wrap up a few of the important things that we hope that you'll take away from this, recognize your limitations. You are only one person, which means you can only do so many things. It is okay to ask for help, and it is okay to accept help. I think sometimes we do have this sense that we're supposed to be able to manage things on our own and not need to ask for help. But if you've had a long day, perhaps you accompanied your loved one to infusion and radiation, and you're tired and it's been a long day, and the neighbor says, "Hey, I'd love to drop dinner off." I think sometimes our immediate reaction is to say, no, that's okay. But maybe that time you say, absolutely, that would be great. It's been a long day, and not having to shop for groceries and cook and clean would be a really amazing gift for us tonight. So thank you. And, accept that help. Another thing to bear in mind is that roles do change. So where your role as a caregiver begins may not be exactly where it ends. If cancer does progress, those care needs of your loved one may increase and may change. But alternatively, as treatment works and your loved one finishes treatment, and is able to resume some of the things they weren't being, weren't able to do before, that that's a beautiful thing. And the role does fluctuate and change, but throughout it all, you have this amazing ability to have such a huge impact on the life of your loved one, to be there for them, to provide support, to have that time together. But if you're ever having a moment where you wonder if you're the only one out there, know that you're not alone. There are so many people providing care to loved ones. In fact, there are the Caregiver Action Network estimates that there are 65 million people in America providing at least 20 hours of care to a loved one every week. So you're not alone, but your ability to provide that help is a wonderful, beautiful thing. We wanted to end with just a little bit of a funny comic. We'll let you look at that. That pill is for your heart. That one is for your eyes. That one is for your blood pressure. That's for diabetes. That's a blood thinner. That is for cholesterol. That's for dizziness. What's for dessert? Just a funny reminder of what caregiving can sometimes entail in terms of medications. So I think that concludes our presentation, but we would be very happy to answer any questions that anyone might have.
Thank you so much, Yael and Rebecca, for that very informative presentation. We do have a couple questions that came through. So question number one, have you experienced extreme anger from a patient when you're trying to be there for them? For example, when you ask questions about how they are feeling or their appointments or treatments, etc. And how do you deal with it?
Yeah, unfortunately, that can be common reaction. In my experience, and I'll let Yael share hers as well in a moment. That anger can often come from a place of feeling out of control, a lack of control about what that person, he or she, is going through. And I think what sometimes happens is that it gets misdirected toward the caregiver, because that is the person that's the closest to them in most cases. And that those feelings, the caregiver means well, it's well-intentioned. You want to help, you want to provide support to your loved one. And sometimes that's the way that comes across. That's the way they respond. So unfortunately, it's common. I don't think it's personal. I think that's one of the things to try to remind yourself, even though that can be really hard, is that it's really not so much about you and most likely what that individual is going through.
Yeah, I'm gonna echo that same tone. I think it's similar. What comes to mind is that children often feel the most comfortable with the people they're closest to, and showing their anger and other emotions that are really stronger emotions that they have. And I think that's true for people going through an illness also. It's you that they're directing it at, because they know you'll be there no matter what. And you have to remember that it's not personal. It's really something that they're going through and they're processing, and it's part of their frustration, but it's certainly not personal and not directed towards you.
And I think that perhaps in that kind of a situation, that it's not personal and it's not directed at you doesn't necessarily help you get through that moment. So sometimes, what you could do is ask the loved one, how you can support them, what they would like from you. Do you want me to ask you how you are, or would you not? Is there a better way for me to phrase something? And then also to let them know that you are trying to help, and that it might be hurtful or hard to be spoken to or to be met with anger, and certainly you're entitled to take a break, to tell that loved one you need a few minutes and you need to step away and clear your head, because that's a challenge for your efforts to be met with anger.
I would suggest, like you said, not necessarily having that discussion in the moment.
Right.
Hear that person out, listen to what they're saying, kind of be the receiver of what they have to express at that moment, and maybe at a later time when everything is calmer, say, it seemed like you were really having a hard time there. What can I do differently next time? Or what do you need from me when you are going through that kind of emotion?
Thank you
So,
for, yes, I agree.
so along those same lines, what is the best way to ask a family member, how are you feeling when they're going through treatment and feeling sick and down?
My initial reaction is kind of what we just said, which is similar in a moment where everybody is not, where emotions are not heightened, to Yael's point, which is really an important thing to highlight, to ask your loved one how they would like you to best help them. Again, I know I'm kind of saying the same thing. Certainly we do sometimes hear patients say that they're kind of tired of the, how are you? How are you? How are you? How do you feel? How do you feel? Again, it's coming from the best possible place, but the best thing, because each individual, each patient is going to have a different response, is to, if you, hopefully you feel comfortable to say, do you want me to assume you're fine unless you tell me? Do you want me to ask you? And, try to have kind of an open dialogue with your loved one, if at all possible.
Yeah, I think it depends on the individual relationship you have with the person going through the illness. Sometimes if it's someone that's very close, you can say, I really want to know how you are, but if you don't want to talk about it now, just tell me. And they can be honest with you and you can be honest with them. And if it's someone that's not so close to you, you can just say something like, you look good, or you look like you're doing okay, and then go on to the next topic. And if they want to share differently, or they want to echo what you just said, then they have that option, or they can move on to the next topic with you.
Great. We have one more question here, actually two more. How do you approach a family member who is not listening to what the person wants or needs during the process? So I'm assuming they're not listening to the patient. How do you deal with a family member who is not listening to a patient?
That's a tough question, and unfortunately not an uncommon occurrence. Again, in my experience, it depends on how receptive that person is going to be. It is possible for the caregiver to speak directly to that person and say and remind them that despite all the loved ones that are involved, it's ultimately the journey of the patient, and that his or her wishes are the ones that need to be respected. Alternatively, if the patient, him or herself, is open to it and feels up to it, they could also, directly but respectfully say, it doesn't feel like you're hearing me or listening to me, or you're questioning my decisions, and try to open up that dialogue and those lines of communication. Again, that's not always easy. And that's where the medical care team can try to also be of some assistance too. Not necessarily in correcting the person that's not listening, but perhaps by just reminding the family or the caregiving team, the support network, that ultimately the decisions are those of the patient.
I think it's also important to remember that, going back to having that conversation with the family and picking someone to be the primary caregiver, it's not a permanent thing. It's okay to revisit that and say, we tried it for a bit and it doesn't seem like it's working for either of us. Maybe it's time to have another family meeting and see if it will work better with someone else who's willing to do it. Your role is not set in stone. You can, like we were discussing, you can support your loved one in many different ways, and it may not be as their primary caregiver.
Great, thank you. If anyone else has any questions, please feel free to send them in. But I have one last question here. Are there any resources that you can share with us on caregiving today?
Absolutely. We can share our screen. Yael, should I let you do that?
I can. Sure.
Okay.
Um,
And I will talk while Yael pulls that up, but we do have a slide here with some resources. Locally here in New Jersey, one of the places that we refer to quite frequently is Cancer Care. They have a local branch in Paramus, and they offer quite a lot of services for patients and loved ones. They run a caregiver support group, is why we often refer to them. So hopefully we'll get that up there on the screen for
Yep,
you.
right here.
There we go. So the second one there, that is their national phone number, but as I mentioned, they do have a local branch. So on their website, you can toggle to New Jersey and you can see a listing of the support groups. And as I mentioned, they do offer a caregiver support group, and they offer also one-on-one counseling for caregivers and loved ones, spouses, children. So they do offer some services that are really wonderful.
Great. Thank you so much. I do